Let's see if I can get this camera right. Yes, I can get the camera right. Yeah, I want y'all to see my kind of cute, funky hair. What can I say? I like it. I like it. I like it. Hi, this is Suzette Viernon, and welcome to my channel, Redefining My 60s on my own terms, where I actually created this channel to help women like me who wanted to see somebody who looked like them talk about things that concern them, whether it's skincare or makeup or redefining their fashion, or like today's episode, which dives more deeply into healthcare. Because one of the things that I have learned and I observed of my mom is that the older you get, the more you go to the doctor. I'm telling you, not that you want to, not that you like it, not that you love it, but the aches, the pains, the things that happen internally with your gut and your bones and things that were happening in your body that you did not really know that turn into chronic issues, autoimmune issues. Those things start showing up. They start showing up when you get older. So I know that for me, the one of the first things I thought about after Donald Trump was elected president was what's going to happen to healthcare. And I'm going to tell you what made me jump on. I was watching Anthony O'Neill's podcast. If you haven't seen it, I got to shout him out. He's got a podcast where he talks about wealth, specifically targeting Black wealth, how to build Black wealth. And I love, it's called The Table with A-O. I'm looking over here because my TV is on and I have him on my television. And as he was talking about Trump has been elected president, now what? When it came to financial issues and Black wealth and jobs and work and all the money stuff, I was like, wait, people my age in their 60s are probably concerned about health care. And so I wanted to just kind of more deeply dive into concerns that I had immediately about health care. I was concerned about um, what would happen with my plan. I was concerned about what was going to happen with any subsidies that people who are getting their health insurance through the healthcare exchange, which is the Affordable Care Act's portal to affordable health care, Obamacare. I was concerned about whether the plan that I really favored would still be offered in my zip code. Because what I found out in going through the process of signing up for Medicare, or filling out the application rather, for Medicare, was that there were some plans that were not offered in my zip code. So that was something that I was concerned about. For many people that I know who have chronic medical conditions, you're concerned about the cost of prescription drugs. Under the Biden-Harris administration, insulin was capped at $35, and they gave Medicare the authority to negotiate prices down for people who are receiving Medicare. And under a Trump presidency, that is all in jeopardy. One of the hallmarks of his first uh, run in office, first time he was president, he wanted to repeal and replace Obamacare. And I know some people who were supporting then President Trump were like, yeah, we hate Obamacare. Yes, repeal and replace it. But did not realize that it was the Affordable Care Act, which they didn't want to lose. For many of them who could not afford health care because it was so expensive, were able to afford health care because of the subsidies that that they were eligible for through the federal government. I know for me, and I shared this before, that when I found myself a single parent, entrepreneur trying to build a business, and I could not afford healthcare just straight out because it was just too expensive, I went on the healthcare in the marketplace, also called the exchange, and I was able to find a better healthcare plan. It was just as expensive, but because I was eligible for the subsidies, I was able to afford it. And I got really great health insurance at a really affordable price. Now, under the Trump administration, when he was, well, actually not even his administration, but when he was debating Vice President Kamala Harris leading up to the election, and they were talking about and debating her health care plan versus what he wanted to do with health care, he said he had concepts of a plan, which meant he did not have a plan written in stone, or he just didn't want to share it right then out of fear that it might not be very popular. I don't know. I'm not going to judge because I don't know what was going on in his head. All I know is he said he had concepts. Well, here's the thing that I do know. I do know from his first administration what his stance was. I do know what I have read, seen, and heard the Republican or the conservative stance is when it comes to health care. They favor private insurance. They favor the old way that healthcare used to be in this country. Now, the old way healthcare used to be in this country, as I recall, was if you had a pre-existing condition, you could be denied coverage. Or if you were covered, they had the right to up your premiums, and it could price you right on out. It would make healthcare unaffordable. My personal story was, even though I got accepted for coverage, even through my employer, I got accepted, but I could not be covered for what they considered a pre-existing condition for 6 months up to a whole year, right? And see, every year I'd come up for renewal. So it could mean I'm paying to have coverage, or my employer is covering me for coverage that only will cover anything that's deemed outside of a pre-existing condition. And I don't know how many of you that are listening to me I remember having phone conversations with healthcare provider underwriters, trying to provide enough documentation from my doctors, having to go through my medical records and have the underwriters look at and deep dive down into why my doctor prescribed a certain medication, right? Or why, or double down on the pre-existing condition. And it was up to them to decide whether they felt like it should really be considered a pre-existing condition. I was arguing with them because I remember when my father passed and my physician, the psychiatrist that I was going to for grief counseling, prescribed Prozac. Now, it was situational grief. It wasn't that I had a mental health, a chronic ongoing mental health condition. However, when the health insurance provider saw Prozac in my medical history, they deemed I had a pre-existing condition. So they didn't want to cover me if I needed any other mental health coverage. And you know, situationally, you can go through anxiety because of a job loss. You can go through needing something to help you because of grief, a situational issue that leaves you feeling depressed or anxious, or going through grief is real. And I just use that as an example. But for some of you, I would love for you to leave in the comments what your experience was when you might have been diagnosed with something that might have just been a situational thing. I remember I was diagnosed with GERD, gastrointestinal something disorder, acid reflux. I don't remember the whole name. I used to know it like the back of my hand back in the day. But let's say you have acid reflux or something like that. And let's say you went to the doctor for it, right? And maybe it was a situational thing. Maybe you were being treated for something, and as a consequence of whatever other prescription you were on, it caused you to have acid reflux. Or like in my case, I was having acid reflux and gastritis, but I found out later it was because I was dehydrated. And once I got that under control, the symptoms of gastritis left. But had I been in the old healthcare system, they would have already said, they would have deemed that as a pre-existing condition and denied me anything that looked like it was a result of having any kind of gastric digestive tract type of situation. I'm breaking this down because I feel like a lot of times, and while I truly favored the democratic solution, as I'm sure some of the others of you favored the solution, whether you favor the party or not, you favored the solution, right? Because you love the Affordable Care Act. You love this new healthcare system where you can't be denied coverage for pre-existing conditions. You love that. But many of you didn't realize that this would be in jeopardy based on who you voted for in the 2024 election. I'm not here to judge or harp on that. I'm here to respond, however, to something that happened with me. I had been approved under a specific plan for some fantastic, it was a fantastic Medicare plan that in 2024 was available in my zip code. Well, I ended up getting a letter not too long ago that caused me pause because it was telling me that effective December 31st, 2024, I would no longer be enrolled in that health insurance plan. So I was confused and I called to find out what was going on. The representative told me that effective December 31st, 2024, they would no longer be offering that specific insurance plan, excuse me, in my zip code. And I was very startled because I thought I was approved for the plan for the whole year because it was during the enrollment season, right? No. And the main thing that I saw was with my plan, my out-of-pocket maximum was $2,900. With the plans that I was looking at for 2025, consistent in all the plans was the out-of-pocket maximum had gone up significantly. I'll tell you, with the plans that I was looking at, my out-of-pocket maximum went up to 9,000, a little less than $9,500. That's 9,000, I think it was 9,300 and something. That's the maximum out of pocket for the year. That is significant. Now, I wondered, is this kind of like in preparation for a Trump presidency and what he wants to do healthcare wise? I don't know. But it made me start really, really looking at how I will be affected. Okay? Looking at how I would be affected and thinking about how you would be affected too. Okay? So now that I've given you my preliminary, let's look at what I started looking at. Because based on what Trump said, he has concepts of a plan. So I started Googling. So you don't have to. You don't have to Google. I Googled it because I know for many people in their 60s, depending on whether you're early 60s or late 60s, for many of you, you don't understand all the ins and outs of the internet, of AI. A lot of times you use your grandkids or your kids for that. So I thought it would be important because a lot of people our age do know how to go find YouTube though, right? So I wanted to put something out there that spoke directly to us. One of the things that I do know in my research was that I looked at an NBC News article that looked at potential changes in health insurance under a Trump administration. Okay. Now, I spoke of subsidies that have been available. Those subsidies are part of the 2021 American Rescue Plan. That was something that was started under the Biden-Harris administration. On March 11th, 2021, President Biden signed the American Rescue Plan into law. And that plan was historic in that it enabled all Americans, regardless to your party affiliations or whatever, it enabled all Americans to respond to and to recover from the impacts of COVID-19. Okay? And under that plan, there were certain subsidies that affected healthcare insurance. Okay? I'm looking through the article right now, but that was a significant part of it. There were some other parts of it that were significant as well, but that was significant. And it was significant because when I looked at the article about the potential health insurance changes under a Trump administration, it talked about subsidies expiring They are set to expire at the end of 2025. Now, we know that it was a plan of Kamala Harris to extend or to broaden, to make health care more affordable for all Americans. Now, what I have heard and seen when it comes to Trump's approach to health care, however, is we don't know whether he's planning on extending it, right? We know historically that most Republicans did not want to extend it. They felt like it was too expensive. They favored the other plan or the other healthcare system, right? Now, with this looming expiration, however, how that'll affect you. I know that's what you want to know. First, good news. The good news is because it's set to expire at the end of 2025, you have some time to make plans. And that was something that Anthony O'Neill said. He said, stop complaining about it and start evaluating your standings, where you stand. Instead of spending all your time complaining that your candidate didn't win, start evaluating where you stand and what adjustments you need to make. And with healthcare, if he does not, or I don't know if they can block, I don't know if they can roll it back, I don't know. But if he doesn't touch it right now, it will, however, expire at the end of 2025. That gives you a year and some change. A year and some change to figure out what you want to do. Maybe putting a little money aside, telling your family that instead of slippers, a robe, or whatever they would normally do for you or get you for Christmas and your birthday, let them know that you want them to invest in your health care fund. It doesn't have to be an HSA or any kind of legitimate healthcare savings account, but you can have a little side savings account, whatever way you want to do it. And if people want to give you presents or whatever, be it Christmas, be it your birthday, be it Mother's Day, let them know, I want donations into my health care. Enroll your family into helping you to build a savings so that if if certain things that you've gotten used to expire the end of 2025, you are not going to be in a devastating situation. You will have something to fall back on if your prescription drugs go back up, right? If they go back up, because if they go back to the old model, prescription drugs are expensive, especially those that treat chronic autoimmune type issues. And most diseases are some kind of garden variety autoimmune issue, right? So make sure that you have that as a plan. Now, for people who are a little bit savvier, maybe you can put it in some type of investment, 1-year investment type thing, or something that will earn interest or something like that, that by the time you get to the end of the year, your money will have made some money. And I encourage you to talk with your financial advisor. If you don't have one, I encourage you to get one to evaluate where you stand financially, to see what products are out there that will allow you to take your money out without any penalties in a year's time, or you can take money out of it. I know with my money market account back in the day, I could take out $250 at a time, but that was the only amount I could take out within a certain framework. I think it was $250 a month was the maximum that I could take out. But talk to them, see what kind of money market account opportunities out there, and perhaps you can put it in some type of product or vehicle that by the time you get to 2025, the end of 2025, you'll have something. Regardless to what happens, you'll have something. Because as we get older, health insurance is a biggie. We want to feel good. So I want to tell you that, okay? Let's see what else I have learned here. I think that really sums it up. I'm looking here. Yeah, they said that, okay. While things started with the American Rescue Plan, which was something to help us to recover during COVID-19, to be able to, not just to recover, to be able to live. For some people, that was their lifeline. Well, the Inflation Reduction Act, another piece of legislation passed through the Biden-Harris administration. It was passed in 2022. That was what extended the subsidies through the end of 2025. Okay? So check things out. Don't complain about it. Be about it. Okay? And that was the main thing that I wanted to bring to the forefront right now. For those of you under the sound of my voice, they used to say in my church, for those of you under the sound of my voice, okay? And this is very important. I'm going to say this, and then I'm going to end this because I don't want to make it too long. I'm reading here, this is from NBC News about health insurance after Trump's victory. If the subsidies aren't extended, the Congressional Budget Office, a nonpartisan agency that provides budget and economic information to Congress, estimates that nearly 4 million people will lose their coverage in 2026 because they won't be able to afford it. Okay? Enrollment will continue to fall. Enrollment will continue to fall each year, with coverage reaching as low as 15.4 million people in 2030. Okay? So that's something to be considered. Again, don't complain about it. You've got some time. Prepare yourself for it. Now, I also looked at Project 2025 because when you have a concept of a plan and a lot of the cabinet appointees and a lot of people that you are associated with put together a plan like Project 2025, then I would wager that these people will be people that you're listening to, because I know Trump has heralded the Heritage Foundation. He has praised them. So, and he has trusted them. He trusts them. So for those of you who don't know, the Heritage Foundation among some other people, were the ones that put together Project 2025. Okay. And I believe the infrastructure for that has been being laid for years. The infrastructure, putting people in place, setting things up in place, that has been, the foundation has been laid for years. But anyway, I look at the civilrights.org, Project 2025, what's at stake for healthcare and anti-poverty. Okay, let's see what's happening here. Project 2025 would scale back the use of public health programs like Medicaid and make it harder for people to access them, including through huge funding cuts to Medicaid. Instead, it calls for pushing families toward private plans with worse coverage. And I have heard about private plans, because let's face it, private insurance companies made more money, right? They made more money. There was not as much accountability, checks and balances in place as it was with the Affordable Care Act, right? So they had a little bit more leeway. Rolling back affordable care, we talked about that being costly and more difficult to access affordable health insurance. We talked about that. Reproductive rights is not as big of an issue for women in their 60s. But I know for me, I had a hysterectomy, but they left my ovary. I still have an ovary. And I feel like if you still have the plumbing, then you should care about reproductive rights. It's more than whether you can have a baby or not. It is OBGYN level issues that could be affected. There might be some treatments, some things that physicians may feel like their hands are tied when it comes to those who are in states where there is a abortion ban. I would encourage you to take inventory of where your OBGYN stands, and if there's anything that's coming down the pipe that would affect how they treat you. I know I'm still going through menopausal symptoms. Fortunately, during the fall and winter, I don't have hot flashes and night sweats as much as I used to. But come spring and summer, it's like somebody turns a light on inside of me and I go through it again. So I don't know what would be available when it comes to that aspect of my reproductive health. So that's something that you will want to talk with your OBGYN. And if you don't have an OBGYN, even though most of us women do, something you might want to talk to your internal medicine or family medicine doctor, your primary care physician about. Okay? One thing it does say that might affect you more directly is it does say Project 2025 calls for rolling back HIPAA guidelines put in place to protect the privacy of people who receive reproductive health care. Okay, so that might be of concern. Rolling back anti-discrimination protections in healthcare. Project 2025 would weaken important regulations implementing protections known as Section 1557, particularly as they relate to addressing sex discrimination in healthcare settings. Okay? So if you are a trans woman in your 60s, if you are part of the LGBTQIA community in your 60s, this would affect you. I would think. I would think that would affect you. Okay. So those are just a few things. I'm going to put these references in my description. So if you want to read them in their entirety, you can just click on the link and read more of it, do a deeper dive into it. But I think I've given you enough that I want your main takeaway to be to evaluate where you stand with your health care. And basically, as a part B to that, evaluate where you stand financially, because you may need to put some monies aside or invite your family's help in putting money aside because of things changing. If you're depending on the Affordable Health Care Act, you got your health care insurance through that, or even if your husband is still working or you're still working and your employer is paying for your health insurance coverage, or you get to put, they're paying a significant part of it, that pre-existing thing may still be something of issue for you. So you still need to have something saved up to supplement so that you don't end up not receiving the care that you need because you feel like you can't afford it. Okay? Prescription drugs as well. And as much as you have a rapport with your physician, ask him to give you the real. Ask him to give you the 411. What's coming down the pipe? How, what are the whispers in their profession when it comes to medications? Something that I typically do when a doctor prescribes something for me is I ask them how much it costs. And I don't know if all doctors do it, but I did have a doctor that was able to bring it up on her cell phone because she had an app that told her what the retail cost of that drug would be, right? Or what the typical cost under my drug plan would be. And I could ask her, is there a cheaper alternative? Is there a generic? Is there something that would work just as well, but not as expensive? So these are the kind of conversations, if you're not having them already, that you'll need to start having with your health care provider. Okay? So that's what I wanted to make sure that I talk to you about. I'm going to finish looking at Anthony O'Neill's podcast, Trump's Back, The Truth About His Impact on Black Wealth. And I might put something similar, Trump's Back, The Truth About His Impact on Healthcare. I don't know what my title's going to be, but because I've already done something about Agenda 47 when it's come to healthcare, and also I've done episodes about my own health and wellness regimen, my routines, my practice, if you will, so that I can remain healthy, you're very welcome to check those out too. But this is specific to how Trump being elected president, having a second term, how this could affect you in 2025. Okay? And I guess throughout the next 4 years of his presidency. All right. If you have any questions, please put them in the comments. I would welcome any feedback you have. If you found out anything, if there's more that you can add from your own personal experience, this is not a place for trolls. I'm not coming against your candidate. I'm not trying to push back on that. I'm just telling you the truth because it is true. Whether you like him, you love him, you want more of him, or you don't. These are things that are going to affect you, right? And so this is not anything that's leaning one side or the other. This is just the truth. The facts, ma'am, nothing but the facts. So these are the facts, okay? And these are the things that I'm looking at. And this is what I'm encouraging using my platform in this episode to just get you to think. Because whether you voted for him or you didn't, the consequences will be the same. We will all have to deal with the consequences. For some, it might be less than with others, but for people in the Black community, like where like I used to live, like my mom's generation in their 70s and 80s and 90s, this is big stuff. And it's big stuff because it affects their families. If their families are caregivers, if you are a caregiver to someone up in age, this is important for you as well, because you'll need to know about this as you try to support your loved one. It's important for you to know this as well as you're helping them. Okay, so that's it. If you like what I am sharing, please like, share, subscribe. It's appreciated. Share it with people that you know that maybe the way I break it down makes more sense to them. Feel free, and I'll see you the next episode. Bye now.